Let me be clear. If you're abroad, it's time for you to come home.
Justin Trudeau announcing sweeping new measures Monday as part of the federal government's response to COVID-19 that now includes closing Canada's borders to non-citizens with some exceptions.
We will be denying entry to Canada to people who are not Canadian citizens or permanent residents. This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens.
Trudeau explained that Americans are exempt from the ban in part over the level of integration between Canada and the U.S. That's putting the U.S. in a separate category from other countries. And he adds more work will be done in the coming days to ensure Canadians are being kept safe and that the necessary goods will keep flowing. The Prime Minister, who is in self-isolation after his wife tested positive for coronavirus last week, also announced that starting Wednesday, his government will restrict flights to Canada to airports in 4 major cities, and that anyone who has symptoms of the virus, they won't be allowed to board flights to Canada.
Air operators will be formally mandated to prevent all travelers who present symptoms of COVID-19 to board a plane. Air operators will be required to complete a basic health assessment of every air traveler based on guidance from the Public Health Agency of Canada.
And Trudeau says help is coming to support Canadians who can't come home right now. And something else we're hearing from the Prime Minister. He says that Health Canada will be sharing regular updates on COVID-19 on a regular schedule. Noon Eastern daily. That's when we can expect to hear from Canada's Chief Public Health Officer. Now, after Trudeau's announcement today, we did hear from that Chief Public Health Officer. Here's some of her latest advice.
Those of us within Canada are urged to postpone or cancel travel outside of Canada unless it's essential. To increase your personal physical space from others, public gatherings of 50 people or more is to be avoided. Where flexible work arrangements are possible, consider contingencies like working from home if this becomes necessary. And most importantly, if you do develop symptoms, no matter how mild, stay home and follow the instructions of your local health authorities. Doing this will keep protecting others around you and very likely save a life by limiting the spread of this disease.